Every treatment of prostate cancer brings along fatigue, which affects virtually every aspect of your life. In this video, I will share a natural, simple, and very effective way to reclaim back your energy and vitality that does not involve any medications. Studies upon studies have shown its effectiveness, and we will see some at the end of the video. And it has worked for every one of my clients. I'll share a story later on in the video, yet it remains one of the most undervalued and literally unknown tools in our arsenal against prostate cancer fatigue. It is a specific, proven type of exercise scientifically designed to target and reduce the kind of fatigue that comes with prostate cancer and its treatments. And you can start doing it today to massively reduce your fatigue within the next few weeks. Now, I know that exercise might be the last thing in your mind right now if you have fatigue, or you might have never exercised, but trust me, we will not be running any marathons here. It's not gonna be unsafe for you, but then again, this is not gonna be a casual walk in the park. You will have to follow the specific guidelines I'm going to share in this video, or you will improve your health, your fitness, but it will not work as fast and as effectively to reduce the fatigue. I'm gonna share the program with you right away, then later on explain things in more detail and help you integrate it in your busy life, especially if you're a beginner. So keep watching if you want more detailed explanation, or use the chapters below to skip to different parts of the video. Let's dive in. So this exercise as medicine is aerobic exercise. You might know it as cardio. And to make it both safe and effective at removing specifically your fatigue, we will have to use something called the heart rate reserve. And if you keep watching the video, I'll show you how easy it is to calculate it. And we're gonna get the zones of 60 to 80% of our heart rate reserve, and we're gonna exercise between those zones to make it both safe and effective to remove our fatigue. How often? If you're a beginner, aim for maybe 2 sessions a week, and you will find the time that your energy is a bit higher to, as an investment, to do those sessions to reduce your fatigue. If you're more advanced, sounds like you know what you're doing, so do however many sessions you can. But if you're a beginner, start with 2 sessions per week when your energy is higher. How much per session? How long? It will take you around 3 to 5 minutes to get into the heart rate zone, and these 3 to 5 minutes of ramping up the intensity will also serve as your warm-up. When you reach that zone of 60 to 80%, which I'll show you how to find later, do as long as you can. Each minute into the zone will serve as a gold coin that you pay to remove your fatigue. We will use machine equipment for this. Why? Because number one, it's safer. Number two, is usually better for your joints, especially if you have knee or hip problems. Number three, it's easier to reach the zone. And number four, it's easier to stay in the zone. If you are running outside or you're cycling outside, maybe you have to turn, or there is something in the path that will make you slow down, so you might go off the zone. Whereas you will find that using gym equipment, such as an elliptical, a stationary gym bike, a Stairmaster, an incline treadmill, an air bike, or a rowing ergometer, these things make it so much safer, so much easier to reach the zone, and so much easier to stay in the zone. You can find some products that I recommend on my website. You can find cheaper equipment secondhand on things like Facebook Marketplace, or it's very cheap to just join a gym and use the professional equipment there. To monitor your heart rate, you can either use a smartwatch like a Fitbit or an Apple Watch, a heart rate strap like the athletes are wearing. You can find a product that I recommend, and we will see later in the studies on my website. Or many gym equipment, the machine equipment have metallic plates that you touch and they show you your heart rate. So as I said, we will use your heart rate reserve and the zones that are derived from that. What is your heart rate reserve? Well, It is very easy to calculate, and it's a more accurate way to monitor aerobic exercise intensity than just percentage of your maximum heart rate. Do you have to use it? Well, if you're serious about your health and living each day to the max without fatigue, then yes. This is what has been used in the studies, which I link below, and what I use successfully with my clients time and time again. How do you progress it? If you're a beginner, I would ask you to add 30 to 120 seconds each week in each of your sessions. Okay? So that means that if in week 1 you're able to only be 1 minute in the zone, I would ask you the second week to try and aim for 1 minute and 30 seconds, if possible. If not, we're gonna try again the next week. Plus, I would ask you to aim and add one more session every 2 to 4 weeks. That's how you progress slowly, gradually, gently, and in a feasible way. But you will start seeing massive effects on your fatigue. It's going to be massively reduced within the first 3 to 4 weeks. Now, let's take a look at how to calculate these aerobic zones. It's very easy, but if you need someone to do that for you and monitor you and prescribe a specific program for your side effects, you can visit my website and send me a message. Now, we will need 2 things. First, your aids, which is easy, and secondly, your resting heart rate. How do you measure that? The best way would be immediately after waking up, while you're still lying on the bed, don't get off the bed, you use your index and middle finger and you press that against either your windpipe or on the wrist, in this, right here, in this spot. So you start feeling your heart rate and you count how many times your heart beats in 60 seconds. That's your resting heart rate. Then use the link in the description to go to this online calculator, which we will see together. Here, let's say someone is 68 years old and the resting heart rate is 72. Click calculate. It will estimate your maximum heart rate for your aids and resting heart rate. And then it will give you your estimated heart rate reserve, which is your maximum heart rate minus your resting heart rate. And now here you can see it also gave us the target intensity, the intensity targets, the aerobic intensity targets. So we need these 2 numbers, the 60% and the 80%. So for this person, they would have to be in the zone to get the benefits that I'm talking about. They would have to work or exercise aerobically between 125 and 143 beats per minute. Now, I want to share the story of one of my clients and what happened to him when he did this program. Before that, if you find value in this video so far, if you click the like button, it's going to help spread it to those who might need it and raise awareness. So, I had a client 8 months ago, and he was 74 years old at the time, and he was on Lupron, so androgen deprivation therapy, for 1 year and 3 months already by that time. Okay, so he was suffering from fatigue, and he wanted me to help him reduce his fatigue and some other side effects, but let's focus on fatigue for now. He had never done any systematic exercise that much before, but he was suffering from heavy fatigue. So straight away he asked me, can I use walking instead of going to the gym or using something more intense? And I told him, no, we gotta work a bit more intensely, but still it's gonna be fine for you because it's according to your level, as I was saying in this video. I asked him to check if it's okay with his oncologist, if he can exercise. He told me, of course. My oncologist had already told me ages ago that I should start losing some weight and doing some more exercise, so said great. If you're watching this video, please also consult your medical professional before starting any exercise programs. So at that time, his heart rate reserve was 88 and the target zones was 122 to 139. Okay, I asked him to sign up to a local gym and use the elliptical, because the elliptical, as I told him, it's safer. He was having a bit of a irritation in his left knee, so the elliptical doesn't have any impact, so it's great. And plus you can use the most ellipticals have like a heart rate plates that you can use to monitor your heart rate. I see here in the first session, and I use an app with my clients that they see exactly what they have to do each day. So we program each day what they have to do after we speak about their life and their schedule. And once they do the exercise, they write how much they did, so I can monitor all that. The first session, that was a Tuesday, he was 4.5 minutes into the zone, and then he did one more session on a Saturday that was 5 minutes in the zone. So it's about 10 minutes in the zone for that whole week. I asked him to progress by adding one more session every 3 weeks if possible, and try to add 30 to 60 seconds per week in each session. He was able to keep up with that with this very easy and gentle approach. So by week 3, he was already doing 21 minutes in the zone. And even though I had to find a bit of an innovative solution to motivate him to go for one more time in week 6 onwards, and he had a bit of a plateau for a couple of weeks, as his fatigue had gotten a bit worse by week 13. By week 13, sorry, was already 75 minutes per week. So he was hitting that magic number, and he was feeling the healthiest and most energetic he was feeling for years before. He had hypertension that was now under control, and he had a bit of a big gut, and he had lost 5 kilos by that time. Enormous leaps. However, his fatigue was already massively reduced by week 4, and I used an actual standardized tool, a questionnaire that we're gonna see that was used in the studies that are gonna follow later in the video. Now, with him, we did some home-based strength exercise and some other targeted exercise for the rest of the side effects, and also some nutritional changes to support his health and the new exercise regime. But this program was very effective for him. Even though he had an exercise before in his life, it was safe, it was gradual, it was gentle, and it worked. Now, let's take a look at some of the findings of some scientific studies that used this protocol in men with radiation therapy, hormone therapy, and both. Alright, so now you have been through the most important parts of the video, and let's see together some of the studies that I have in the description, what they did and what they found. We will see a study in men receiving androgen deprivation therapy, hormone therapy, another study in men receiving radiation therapy, and another study in men receiving both. So you'll see exactly what happened to them. If you watched so far into the video, please consider leaving a like. It helps spread awareness, and especially to those who might need it. And if you want to work with me one-to-one to manage any side effects you have from your prostate cancer treatments, or actually using exercise to enhance the treatment effectiveness and also fight the cancer, please send me an email using the link in the description, my website. Alright, this first study had 66 men with prostate cancer about to start receiving ADT. Okay, ADT is the hormone therapy, the androgen deprivation therapy, testosterone suppression. Okay, they were gonna have ADT for 6 months, and they were randomized to exercise either home-based aerobic exercise or home-based resistance exercise training. And they looked at different things. They wanted to see how the men would fare in these two different exercise interventions in different outcomes. So they were looking at quality of life, they looked at fatigue and other outcomes. So let's have a look at the characteristics of these men. So 32 in the aerobic exercise group, 34 in the resistance exercise group. Their ages were similar, around 70 to 72 years old. And we see here that the Gleason scored varied, okay? You see here the numbers in each group. Again, left is aerobic exercise, right is resistance exercise. And we see that there were also different stages of prostate cancer. At the same time, some of them were receiving ADT alone, or some of them were also receiving antiandrogens. Okay, so these are the androgen receptor inhibiting medication. The aerobic exercise intervention was very similar to the one I prescribed in this video. 60 to 80% of heart rate reserved. They use a heart rate monitor, Polar, and actually I have this heart rate monitor on my website if you wanted to find it easily. It's a great one. I have it personally, and it is waterproof, and it can measure a lot of things, heart rate, variability among others. Okay. What did they find? Let's have a look at this table. I'm just gonna shift it to the right. So remember, this was a 6-month intervention. Which table is the best? This one. So this one shows you the fact F is a questionnaire administered to measure fatigue, and fact P is a questionnaire administered to measure quality of life, specifically in prostate cancer. Higher scores in fact F indicate greater energy, okay? Lower scores indicate greater fatigue. Fact P, higher scores indicate greater quality of life, okay? So baseline, both groups, they were not significantly different, but we see the aerobic exercise group 3 months into ADT, 6 months just at the end of ADT, had preserved their energy, 42, okay? And ADT is something that causes fatigue in a lot of men. And also fact P, the quality of life was preserved, both during the treatment, at the end of the treatment, and 12 months from the beginning of the treatment. Now, even though there was no significant difference between the groups, there was a trend for the resistance exercise group to have lower energy and lower quality of life, but we cannot really say that. If the statistical significance is not there, then we cannot say that one is better than the other. I want to show you this next study. This study was in men with localized prostate cancer, okay? And they were going to undergo radiotherapy. There were 2 groups. One group received radiation therapy. Both groups received radiation therapy 3 times a week for 8 weeks. One group just did exercise immediately before the radiotherapy. Let's look at the protocol for the radiation therapy that they received. So each participant received around 70 grays in about 34 to 38 fractions, okay? So that's a lot of fractions there. They measured fatigue using this scale. It's 0 to 10. Higher scores indicate greater fatigue. Okay, just keep that in mind. And I just want to show you the protocol. 10-minute warm-up, 30-minute aerobic segment consisting of walking on a treadmill, and 5-minute to 10-minute cool-down period. And they use this following formula, which if you use it, it's about 70% of the heart rate reserve, which is the thing that I told you to use. I just want to show you the baseline for the PFS. That's the fatigue. So remember, higher scores indicate greater fatigue. So group 1 was the exercise group and group 2 is the control group. Actually, even though there was not statistically significant, it seems that the exercise group in general had a bit higher fatigue before starting either radiotherapy or exercise. Okay, just at baseline, just a bit higher. And these values are 0 to 10. So what did they find? So the exercise group PFS, which is the fatigue, showed statistically significant improvements, so the fatigue dropped. Whereas the control group showed significantly worse post-radiotherapy scores on fatigue. And let's have a look actually how much, okay? So for the exercise group, it was 2.4 out of 10, and the control group was 1.1 out of 10. That was before exercise or radiotherapy. And that's the values after. That's the change of the values from the baseline. So the exercise group actually decreased in fatigue 1.6 points, whereas the control group that did no exercise, just radiotherapy, increased by 2.7. Now, bear in mind that even though it's a 0 to 10 scale, a 2.7 increase doesn't mean it's 27%. No, if you compare it to the baseline value, so from the exercise group went from 2.4 out of 10 and decreased by 1.6. Okay, that's a 67% decrease in fatigue. Whereas the control group went from 1.1 and increased by 2.7. And that is a 245% increase in fatigue. Okay, so we have to compare it with the baseline values. So the exercise group from the baseline, even after receiving radiotherapy, actually decreased the resting fatigue by 67%. Whereas the radiotherapy group that did no exercise, just radiotherapy, which is the same radiotherapy that the exercise group received, but they did not do any exercise, their fatigue increased by almost 250%. All right? Now, the last study. So, in this study, we had 65 men. The control group that did no exercise had 33 men, and the exercise group had 32. What did they do? They were receiving radiation therapy. They received 50 grays in 20 fractions over 4 weeks. Okay, so they visited 20 times to do radiotherapy. However, in this study, 19 of these 66 patients were receiving adjuvant hormone therapy, so ADT, for high-risk tumors, and that was 10 of 33 patients in the control group and 9 out of 33 in the exercise group. And 9 of the 66 patients were receiving beta blockers, including 2, only 2 in the control group and 7 in the exercise group. So it seems like the exercise group had more men who were receiving some sort of hormonal castration. Okay, just keep that in mind. What did they do? They used the brief fatigue inventory questionnaire. Again, this is a 0 to 10. In these questions, you rate 0 to 10. That's another tool to measure fatigue. I have personally used it in my research previously. They did continuous walking for 30 minutes on at least 3 days of each week of radiotherapy at a target heart rate of 60 to 70% calculated maximum heart rate. Okay, so that's what the exercise group did 3 days of each week. If you calculate that, that's a bit lower than the intensity that I ask you to work at. That's about 50 to 60% of heart rate reserved. Whereas I told you to work at 60 to 80%. Okay? So even with a lower intensity, let's see what happened. In the control group, there was a significant increase in fatigue scores at the end of radiotherapy compared with baseline. And there was no significant difference in fatigue scores for the exercise group. Let's look at this. Top is the control group. These men had 20 fractions of radiation therapy without any exercise. You see the fatigue is starting to go out of whack here. Whereas the exercise group, yes, it did have an increase, especially because it had more men on some form of hormonal therapy. At the end of radiotherapy, you see the difference, how it was suppressed. So the increase of fatigue that the control group experienced was suppressed in the exercise group. Now, can you use specific exercise as medicine protocols to reduce erectile dysfunction, urinary incontinence, things like hot flashes, things like weakness, or all the other side effects you may experience during prostate cancer itself or the treatments for prostate cancer? What about waking up at night to reduce bladder urgency if you have, for example, an enlarged prostate? Well, all those things are coming in future videos, and I hope you enjoyed this one. If you try the protocol, please let us know in the comments, in the description, what you experienced. I would be very keen to read your experience with it. As always, there are products that I recommend on my website. You can check them out. And if you want to work one-on-one with me to help you reduce all those side effects, live better, stronger, healthier, and beat the cancer, you can find me on my website. Thank you for watching, and I'll see you on the next video.